A very good evening, all. I'm Ajay Lodha with the Wednesday night edition of South Asian News, Vision of Asia. We are coming to you from our studio in New York City. Welcome to the show. Let's begin by taking a look at the coronavirus pandemic. Globally, we are looking at 60 million cases of the coronavirus with at least 1.4 million deaths. In the United States, we have surpassed 12.7 million cases, and the death toll from COVID-19 in the US has now surpassed 260,000. The daily US deaths from COVID-19 has surpassed 2,000 for the first time since May, and with hospitals across the country reaching capacity at many places. With another 170,000 people infected, experts are saying that COVID-19 could grow with millions if Americans disregard official warnings and travel for tomorrow's Thanksgiving holiday and the weekend ahead. With US hospitalization reaching a record high of 87,000 yesterday, all experts across the nation are urging people to keep Thanksgiving this year as small as possible. They're also saying that this Thanksgiving could be the mother of all super spreader events of COVID-19. 28 states are showing upward trends in new reported cases. So again, please remember the importance of social distancing, washing your hands, and wearing a mask. It protects us and others around us. Eyes again continue to be on the vaccine for COVID-19, with many vaccine trials showing promising efficacy and a plan to start the initial distribution of the vaccine by December. Meanwhile, in politics, the transition process of the incoming Biden-Harris administration has begun officially. However, President Donald Trump has yet to officially concede to President-elect Joe Biden. On the President-elect Joe Biden, yesterday he surpassed 80 million votes after recounting in several states. This is the most number of votes a candidate has ever received in the U.S. history. So what is the impact of this election on the South Asian American community and its issue? And what do we need to watch out for tomorrow's Thanksgiving holiday with COVID-19? We speak tonight with elected officials, doctors, and more. Here are the headlines. Dr. Tushar Patel urges all to wear a mask. COVID-19 updates and measures, New Jersey. Senator Sepúlveda on winning re-elections, COVID-19 and Biden-Harris administration, District 32, New York State Senate. Visionary leader Dr. Ajay Lodha succumbs to COVID-19, American Association of Physicians of Indian origin. A lot more on the other side of the break. Stay with us on Vision of Asia, voice of the community. We'll be right back. And welcome back. I am Ajay Lodha, and this is Vision of Asia, Wednesday night episode of South Asian News. Let's continue discussing the coronavirus pandemic updates, with cases surging across the nation, especially in the Midwest, and the Thanksgiving holiday tomorrow concerning doctors nationwide. With U.S. hospitalization for COVID-19 reaching a record high of 87,000 yesterday, nation's leading officials are urging people to keep Thanksgiving as small as possible. Director of National Institute and Infectious Diseases, Dr. Anthony Fauci, stressed the need to hang in there a bit longer on wearing masks, maintaining distance, and avoiding crowds, especially indoors. He said, if we do those things, we're going to get through it. And so that is his final plea before the holiday. Meanwhile, many parents are balking at online instruction while others worry about sending their kids back into classrooms prematurely. Some teachers say they are not comfortable teaching in person. On vaccine, with various candidates showing positive results, about 40 million doses could be distributed by the end of the year, and the Food and Drug Administration ruling on emergency use of Pfizer Inc. is expected on December 10th. So what do we all need to know, and how should we protect ourselves on Thanksgiving? We speak with health expert Dr. Tushar Patel, urging all to wear a mask. Here is Dr. Tushar Patel. While we are talking about social distancing, I would love to know your comments on indoor dining or indoor activities. At this point, should these activities be stopped, such as the gyms or the restaurants and other things?
I think because that will be the best approach right now. Gyms and indoor restaurants, whatever we can do right now to mitigate or slow the spread, I think that will help. The lessons learned from previous months, especially in our area, if we do that, I think we will see better results in January and February.
Are there any therapeutics that are in the works right now?
So as you know, remdesivir was approved, and now another one is approved, is called Regeneron. So we have two therapeutics right now approved by FDA to use for COVID-19 patients in the hospital. Regeneron is just one dose IV medication one day. which is very effective. That is what President Trump received when he was in the hospital. So I think we do have some therapeutics available right now, but it doesn't work on everyone. So it's case by case. So we have to be still very careful of using the common sense.
Let me ask you something. Do you think COVID is still a mystery to most doctors? Is it still a disease that we still have no idea how it's mutating in a body?
You are absolutely right. This is like a 9 months old baby, right?
Right.
So you don't know how the baby will behave when he or she become child and adult. So it's the same thing. We need to have more studies, and the studies at least takes 1 to 2 years in order for the epidemiologists to come up with some kind of logic and some kind of science behind it. Why this is happening? Why is this happening to certain population? Why the medication is working on why some people has to go on ventilation. All those things are still premature. We do have a lot of information now than before, but still there are a lot of mysterious questions for the medical professionals as well as CDC and other healthcare agencies.
Let's talk about vaccine, because obviously that's the $1 million question that everybody's asking right now. How are you looking at Pfizer, Moderna, as well as AstraZeneca? I know they're releasing their efficacy in the vaccine. Could you give us an insight into what's happening in that domain?
So this is the forecast I'm expecting. By end of December, high-risk people, the medical professionals, the elderlies, will start getting the vaccination by end of December. By end of April, early May, low-risk general population will start getting the vaccination. By end of May, early June, the goal of this country to have 70% of the US population receive the vaccination. That will give us the herd immunity, and then we will not have to wear the mask or going in public places with fear.
We now have a sad news, another great life lost to coronavirus. New York-based physician, businessman, and an Indian American community leader in the tri-state, Dr. Ajay Lodha has passed away from COVID-19 after struggling for 8 months at the age of 58. Former president of API, the American Association of Physicians of Indian Origin, Dr. Ajay Lodha was honored with the prestigious Ellis Allen Medal of Honor and was also honored with the Nargis Dutt Memorial Foundation Physician of the Year Award. API President Sudhakar Jonalagada expressed his shock and sadness, saying that the passing away of this visionary leader is the darkest day of API history. ITV Gold Parekh Worldwide Media's chairman, Padma Shri Dr. Sudhir Parekh, said that Dr. Lodha was a wonderful man, always working for the betterment of his fellow human beings. In his honor, API has created the Lodha Distinguished Service Award through GoFundMe to help make impact and educate members of the medical profession on current activities and new products. Dr. Ajay Lodha is survived by his wife Smita, son Amit, and daughter Shweta. We, the team of ITV Gold Parekh Worldwide Media, send our deepest condolences for the family and friends of Dr. Ajay Lodha. Here are some community leaders speaking at Dr. Ajay Lodha's funeral services.
Thank you all for coming. Thank you all online for joining us. I do wish we were all together right now, but because of everything, we can't, and it's just that much more difficult. There's a lot I can say. What I do want to say it took me a very long time to truly understand how special of a person my dad was. So after my dad got sick, it took me a very long time to really understand how special of a person he was, and really all the lessons he was trying to teach us. There were times when he was a very difficult person to be with, and I think everyone knows that. Everyone has their story of some fight, but everyone also has a story of how he helped you and how he really cared so much about what you wanted. And understanding what that meant took me a very long time. Only this year, after he got sick, and just listening to everyone's story, that's when I started learning. And it was like a trial by fire. And I think this year he gave me the best lesson of all of really how to become a better person. I wish I had understood this earlier. And if I could become just half the person that he was, I think I would have lived a good life. So, Papa, thank you for everything you've done. Thank you for putting up with me. I finally understand all the lessons you were trying to teach me. I'm going to try my best to uphold them and continue your legacy. Thank you very much. All of us will miss you a lot.
Papa sacrificed his life serving the community and his patients. He contracted the virus in March by providing care to the most vulnerable patients. His work as a frontline COVID warrior is a testament to his bravery, his courage, and his altruism. While my dad has a decorated list of accomplishments, I most know him as my superhero, my protector, my mentor, and my best friend. He taught me how to fight and stand up for what I believe in. He taught me how to work hard and prioritize community. He taught me how to go above and beyond to help others. I will miss him every single day more than words can describe. But I'm so proud of the legacy he has left behind, and I'm so honored to be his daughter.
Bhagavad Gita says, "No weapon can cut the soul into pieces, nor can it be burned by fire, nor moistened by water, nor withered by the wind." This is the power of the soul and the personification of my father-in-law, Dr. Ajay Lodha. Rising from Udaipur, he came to the United States with a dream. Like many of us, he strived for a better life for his family. In one of his interviews, he was asked about his dreams. He then replied, "Every life is very important." Papa was a COVID warrior, a real-life superhero. With unlimited confidence, he was absolutely fearless. With a remarkable personality, he always made sure to shine his charismatic figure around us. He accepted challenges and climbed the ladder not only of success but of humanity. He never forgot those who helped him in his journey. He stood by all of them regardless. Papa has many dreams for us, and we will always work hard to continue his legacy. He always gave me indirect compliments. To me, he said, "I'm not handling any decoration for the reception on May 9th. You are," which for me meant that he trusts me so much to handle everything for an event. As soon as he met me, he started asking questions to understand the jewelry business, and I instantly knew his next project was going to be to become a jeweler. And without a doubt, it was his next project. I promise you, Papa, I will always hustle and make sure I get out of my comfort zone to reach the top. I knew my father-in-law for 3 years, and the amount of love, respect, and trust he had in me has only given me confidence to show that one day I can make an impact on thousands of people in the world just like he did. Papa, I will always, always miss you and cherish every single moment we spent together.
Ajay bhai, you have been an amazing mentor and advisor and big brother for many like me. I cannot forget but can only cherish the moments we shared together. Ajay bhai, thank you for giving me your bed and sleeping on the couch whenever we shared rooms together on our travels. Thank you for being the go-to guy for routine mundane things in life. Thank you for spending endless hours trying to advise me to be in the right direction and to serve Api better over the years. Thank you for the endless banter to humor me during our daily routine commutes to work. Thank you for passionately standing up for me and believing in me. Thank you for being there and sharing with me the great moments and not so great moments. Thank you for dreaming big for me and being more excited than me when I took over as the president of API, and dreaming big for the Chicago 2020 convention, calling it will be a mega convention. Thank you for texting me from your hospital bed that you are going to fight this deadly disease until the end, like a true Rajasthani warrior. Dear Ajay Bhai, we are forever indebted to you for what you have been to the Indian community, medical fraternity in India and United States.
It's time for a short break. Stay with us on Vision of Asia, Voice of the Community. We'll be right back. Welcome back. This is Vision of Asia, the South Asian news segment, and I am Aditi Lamba. Let's now take a look at election 2020 results and the path moving forward. As we all know, now President-elect Joe Biden has formally introduced his top members of his foreign policy and national security team as the transition process into Biden-Harris continues. Meanwhile, President Donald Trump has yet to concede, and his legal options and challenges are running out as states recount ballots and certify Joe Biden as the winner of the presidential elections of 2020. The Biden transition team has kicked into gear after much delay and reluctance by Trump administration, and the U.S. President-elect Biden will announce his economic team and other key nominees next week. Biden's transition team is focusing on COVID-19 response and the urgent national security threats, and has finally started receiving more classified information which is shared between an existing and an incoming administration. So where are we headed until the inauguration date, January 20th? And what is the impact of COVID-19 ramifications? We spoke today with New York State Senator Luis Sepúlveda, discussing much on politics and also his re-election in District 32nd of the New York State Senate. A deeply engaged state senator in creating economic, healthcare, and education justice. Here is our conversation with Senator Sepúlveda.
And what COVID has done is it has highlighted the systemic racism that has led to some of the conditions that we have in our community that have to do with food insecurity, with health, with housing. I mean, all of these issues have surfaced to the top because of the impact of COVID. You can see that it was our communities, primarily communities of color, that suffered overwhelmingly in terms of death and infection rates of COVID. And so we, as legislators now, hopefully we'll have a session before next year, but if not, one of the things going to be up front and a priority for me and for many of my colleagues will be the issue of food insecurity, how we can food our communities. Now, why can't we feed every person in our communities or in this state or in this country? Right. is bewildering and baffling to me. And when the president minimizes the impact and behaved the way he did, and even admitted that he tried to minimize the dangers of COVID, when the leader of the country failed to lead by example, it's refreshing to have new leadership that understands that the only way we're going to get out of this is by allowing the scientists, the experts, to be the ones running the vehicle, and not allowing political appointments or television doctors or television celebrity doctors to be leading the charge of the way. We need people like Anthony Fauci, who has been disregarded by this administration. We're talking about one of the premier epidemiologists and scientists in the world, and yet he was put in the back seat and ignored. Same with Dr. Bix. These are people that are the experts, and yet they were ignored because they took the position that face masks were important, and crowds were essentially breeding grounds or super spreaders for COVID. The immigration system was probably the area where the current president demonstrated his cruelty and his indifference to human suffering. I mean, to have a policy by a despicable human being named Steve Miller, who their policy was to intentionally separate families, separate children from their families, so that people would be afraid to come into this country. And we're talking about people who were seeking asylum, that were trying to come into this country legally, and barriers were created so that they could not come in here legally. And so we see that the president-elect has appointed the first Hispanic, Alejandro Mayorkas, to be the head of Homeland Security. That is a game changer in ways that you will see once he becomes the Homeland Security chair, because we're going to have someone who is sensitive to the issue of immigration from all over the world, someone who I know, President-elect, I know, will never tolerate a policy that separates children from their family, and then many of these children can never be reunited with their families. We're going to have a new Secretary of Homeland Security who will not create impediments to legal migration, like people who are seeking asylum at our borders.
What do you think is going to happen up until the inauguration day, January 20th?
Well, I mean, you're seeing that inevitably, even though I think a lot of the comments and behavior of the Republicans in this country, I think a lot of this is geared towards trying to win the Georgia Senate race. I believe that that's why he's saying that he won the election to rile up the voters in Georgia that would vote for Trump or for the Republicans. I believe he's setting the stage for his post-White House career, which we know that he's going to continue traveling the country and doing what, generally speaking, most ex-presidents don't. You know, there is an unwritten rule amongst presidents that you don't criticize the current president, you don't criticize the previous president. You have a transition that is in the best interest of this country. I don't see Donald Trump doing that. He will continue to denigrate our election process without a scintilla of evidence. He will continue to try to placate those who believe that there was widespread fraud in our election system. First of all, I want to wish everybody a happy and healthy Thanksgiving during these very, very difficult times. I empathize, I understand. I have not and will not be able to spend Thanksgiving with my father, who is bedridden, has Alzheimer's and dementia, with some very close members of my family that are the oxygen to my life. You know, aunts and uncles that I absolutely adore. I will not be able to see them. I will be essentially self-quarantining or not traveling so that I can spend time, so that I don't put any member of my family at risk. So I feel, I empathize, I sympathize, and despite that, I still think we should do everything we can possible to have some semblance of Thanksgiving. But please do not travel if you do not have to. Please do not go into areas with many people. Let's not make what some people are calling, including the governor, the possibility of Thanksgiving being a super spreader of COVID. Let's try to make the best that we can.
Well, this wraps up our show for the night. Please send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook at itvgold. You can also subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Aditi Lamba. Take care and be well.